Robotic surgery is the new kid on the block, especially for the knee replacement and hip replacement. People are very excited, and their excitement is compounded by various social media platforms with some myths and some not so true facts. At the same time, it is a technology which takes in advancement, is here to stay, and over a period of time it is expected to improve. Robotic surgery, but there are many surgeries which can be performed well only with a robot. Let's take a situation, somebody had a fracture at some stage in the life and a nail was put into the bone. Now, in the conventional method, you have to remove that nail and then only can you do a knee replacement. But with a robot, you can do that knee replacement without having to remove that nail, which is a huge comfort and reduces the problems with the patient. Other situation, when patient has had a fracture and what we have to do is we need to bypass that fracture to put the joint. One option would be to actually cut that fracture, make it straight and then do the surgery. Other is to bypass this surgery using the robot. There's the other side of the story. There are experienced people who can do the routine surgeries fairly well, reducing the cost and the effort and the time of surgery without using the robot. Now, this doesn't mean that you don't use the robot or you use the robot, but all I have to say is, if you are going to your own home, you will not use the GPS, but if you are going to a new place, you will use the GPS. So if you are relatively younger, newer surgeon learning newer technology, or they are the complex cases which I mentioned about, robot is going to play a huge role. Finally, one must understand it is not the robot which does the surgery, it is the surgeon which controls the robot and not the robot which controls the surgery. So choose your surgeon wisely. The robot may be any one of them.